Hello everyone, Dr. David Kulla, your New York City chiropractor, here with a case of tendonitis in the knee. We've got Kelly here. We're going to show you how we treat tendonitis and arthritis in the knee. This is a really effective treatment called cold laser therapy. So we're going to sandwich her knee and thigh with 2 lasers just to speed this process up. Okay, first what I want to do is check her range of motion. So I'm going to have you bend your knee as far as you can, and we're going to take a look at that and see. Tell me when there's pain.
Yeah.
Right there? So I would say that is about a little bit less than a 90-degree bend. Can you bend any further, or is that
Okay.
right there? Okay. All right, so go ahead and straighten that leg out, and just rest it on the pillow here. Yeah. Okay, so we're going to do some laser here to reduce the inflammation in the infrapatellar tendon and the medial meniscus specifically for her, because she has some arthritis in those areas. So this laser right here, this blue one, checks for areas of inflammation. So I'm just going to scan her knee, and we're going to just check for areas of inflammation and soft tissue damage. We're scanning over the medial meniscus now, and there we go. And we're going to dose that. Now, while I'm doing that, I'm going to laser the top of her quad, because she was complaining about pain in this area right here and a lot of tightness. And as soon as we loosened her quad muscle up, she was able to straighten her leg out a little bit more. So we're going to relax the muscle tension in the quad. We're going to reduce the inflammation from the inferior infrapatellar tendon. Excuse me, I'm tongue-tied today, folks. And the meniscus. And you'll see her range of motion increase significantly in just one treatment. So you'll hear this laser beep again when it's done dosing this spot here over the medial meniscus. And you don't feel anything, do you? Okay. So as you can see here, folks, I have 2 different lasers on her. The blue one here in my left hand is a 50-watt MR5 Active Pro, and the one on the right is a multi-radiance TERRAQUANT laser. A lot of people ask me what kind of lasers I use. These are from multi-radiance. This one here in my right hand is a 25 watt, as I said. So the treatment times are a little bit longer with this one on the right, with the white laser emitter. And this has been on her knee in the medial meniscus spot for at least 2 minutes. So that tells me that there's some, significant inflammation in here. Typically a treatment time would be a minute or so. And we should get that to beep here in a minute, within the minute. How you feeling, Kelly?
I feel okay.
Okay, good. And there we have it. We're going to scan under here. We might hear a beep here too in the infrapatellar tendon. And there we go. And not only is this going to reduce inflammation for the arthritis, but also for the tendonitis. This is really a game changer. Cold laser therapy is hands down the best thing for tendonitis or arthritis. There's no side effects to it. It's safe and effective. So we're going to scan the infrapatellar tendon and around it, both medial and lateral meniscus. And it beeped over the lateral meniscus too, showing some inflammation or damage there as well. And again, the beauty of this blue one is it'll beep when it's done dosing. The other one, the white one, doesn't tell me that, but I'm able to time it and do it other ways and know how much to dose the area. I've been using lasers for about 12 years now, so it's really all about how it's applied. So a lot of times people may get cold laser therapy, but if it's done incorrectly in the wrong areas, the wrong frequencies, the wrong protocols, then you're not going to get as good at results. So They do sell lasers over the counter that you can buy. And, you know, anywhere from, I've seen them cheap, like $500 all the way up to thousands of dollars. I'd be careful doing that without you know, someone referring you, like a physician that knows what they're talking about with cold lasers, before you just go buy anything on the market, because a lot of them are not lasers. They're actually they're LEDs, and LEDs are fine, and some lasers are mixed with LEDs, which is fine, but LED is more for the surface of the skin. It's not going to work in a deep tissue sense down to the ligament and tendon and disc area like a cold laser or low-level laser would. So again, LED is different than laser, so just be careful what you get. We're going to finish up with her knee here, and then we're going to just check the range of motion real quick. Okay, now go ahead and bend the knee. You can, I'll slide this out if you can go further. Okay. Can you go any further? Okay. How about any more? Okay, good. How about more? Can you bring your knee to your chest?
Let's see.
Okay.
But not as.
Okay, that's a lot better than what you were before, though. It's a lot better. Imagine 2 treatments a day over the course of a week or 2. Okay, great. All right, folks. Thanks for tuning in, everybody. If you have any questions or comments, don't forget to comment below. I'll try to get back to your questions and comments regarding knee, arthritis, tendonitis, and/or cold laser therapy. Thanks for tuning in.